Good morning, my name is Jocelyn Hernandez and this is my presentation case study. The patient I received was a 17-year-old male athlete with a swelling knee that is painful when he sprints, squats, walks down the stairs, and or does his track practice. After examination, I can see that he has a decrease in knee flexion. He has weaknesses in his mid-quadriceps and hip muscles and has a limp, also known as altigic gait. Ali states that physical therapy is a healthcare profession concerned with human function and movement. Thompson agrees, saying it encourages development, facilitates recovery, and enables people to be fit and healthy, playing a significant role in rehabilitating pain and function in the patient. The book adds on that it helps individuals maintain, restore, and improve movement and functioning. Physical therapy was born in England and France. Two major events that developed this profession and its role in healthcare was the polio epidemics from 1894 to 1916, where thousands of children had paralysis. The second event was World War I, which created reconstruction aids. The most famous one, because she was the first one, was Mary Macmillan, trained in England and in physical education, first female reconstruction aid in the U.S. Army, and she established the PTA department in 1917. This program begins in 1967. And in 1969 was the first PTA graduate. PTA would start the treatment or plan of care given to or created by the PT. They could also collect subjective data like their medical history, their problems, their complaints and pain, what the patient is reporting. They would assist the PT in the treatment, specifically like increasing range of motion, strengthening his quads and hips by giving him cold compression and doing exercises to return him back to his main sport, which is track. In general, PTA services and these exercises will decrease his inflammation, strengthen his muscles. The PTA, on the other hand, will provide safe and effective care, make sure they don't damage or injure themselves while doing the exercises. They will make sure they implement the PT's plan of care and make sure exercises are effective and target the main goal that they want. Some interventions AJ may need will be strengthening his quads and hips, decrease the swelling with cold compressions or ice, simulating walking up and down the stairs, which is something he's currently having trouble with. He would need to practice his gait training, relearning how to weight bear in both of his legs, and then return slowly back to his sport. Physical therapy is important because it returns patients to having optimal quality of life in relation to their movement caused by diseases or injuries, in this case AJ with his knee and quad injury. The PTA role is also important because it helps execute the plan of care, making sure that the patient is safe when doing the exercises and that they're doing the appropriate exercises so they can get back to their target goal, in this case going back to track and running. In conclusion, the PTA will teach AJ how to treat his injury, prevent the re-injury, safely regain his range of motion of his knee, hips, and quads without pain, and returning him back to his sport safely, because we don't want him to get hurt again. Thank you.